Hi, my name is Angela Myers, and I'm the Division Director of Infectious Diseases at Children's Mercy, Kansas City. And next to me is Dr. Jennifer Watts, who is the head of emergency preparedness for the emergency department at Children's Mercy. Yesterday, we received our first positive COVID-19 test. The child presented in our Adele Hall campus emergency department Sunday evening with cough, sore throat, and a history of fever. After being fully assessed and found to have a minor illness, the child, who also had possible contact with the coronavirus, was swabbed and then sent home. We received confirmation yesterday morning that the child's swab was positive for COVID-19. We notified the family of the test results. The family agreed to self-quarantine. We reported the case to the Kansas City, Missouri Health Department, who will notify the health department in the area where the family lives. We spoke to the family this morning, who reported that the child is recovering at home. The child's symptoms are consistent with a mild infection. At Children's Mercy, we are always prepared to handle any infectious disease, so this is not new to us. We followed our standard protocols, and we are confident that in evaluating this patient and any other child who presents to us, all the necessary precautions are taken to limit transmission of disease and infection. We have one of the best trained pediatric medical staffs in the country who have prepared their entire medical careers to meet moments like these. We will now open it up for questions.
Did you say the age of the child?
I cannot give you medical information about the child.
Give us a range.
Would an age, I mean, is that, an age is secret? Why is that?
No, we've gotten ages on other ones.
That's for the health department to.
The health department, you may call the Kansas City Health Department and get more information that way.
How about sex? It's just hard for us to describe it. We can't say boy or girl.
The health department will be able to give any information like that, but we cannot
That's horrible.
share the information.
As
It's
far
basic
as-
information.
As far as parents are
It's a
concerned,
pandemic.
a lot of people have been under the presumption that children are not, immune's not the right word, but children can't catch this. Now, all of a sudden, parents are going to hear, and warning bells are going to go off. What do you say to them?
Children are certainly being infected with coronavirus, just like adults are. The disease process tends to be much more mild in children than it does adults, however.
And so that might think a parent might have a kid with flu-like symptoms and they think it's just the flu and not, for lack of a better word, not pay attention to it. Is that what?
So there are many viruses that are co-circulating right now, and influenza is one of them. But symptoms of cough, or shortness of breath with or without fever is also consistent with coronavirus disease. If your child has mild symptoms, you should be staying home and not seeking medical care unless they absolutely need to be seen by their healthcare provider, and the family should be calling their primary care physician.
Can you say how many COVID-19 tests you have sent off to be processed?
Sure, we have tested 103 children, and we have had the one positive.
How are you able to do that? Because up until a couple of days ago, we've been told that tests are being reserved for high-risk population. Has it changed in the last couple of days?
We have been able to send our testing to a local reference lab here in town.
Do you have plenty of test kits?
We have an adequate supply of swabs to test the kids that need to be tested.
I know we were told by the state earlier that there's a lab, commercial lab in Lee Summit that's able to do 1,000 tests a day. Is that what we're talking about?
Yes, we are using a commercial lab here in town that other facilities are also using to send their tests to.
And just so I'm clear, the Lee Summit lab that was mentioned by the state earlier this week?
Yes, that is correct.
And in this instance, the child was brought to the emergency room, and that's as far into the hospital as they were taken.
Correct. This child was brought.
Wait, so
Sorry.
we'll move it on over there.
You can't talk.
Sorry.
Can you say how many of were all the kits patients, or were some of the kits used for staff?
We have tested 103 children for coronavirus disease. We've tested 27 employees, and we have an additional 9 planned for today.
No positives for staff.
No positives for staff.
Anybody been quarantined or sent home?
We are abiding by the Kansas Department of Health and Environment quarantine precautions for those who have traveled to areas that the Kansas is now requiring.
And you mentioned this patient is a Kansas City, Missouri family, right? You said they're...
So this patient was seen in a Kansas City, Missouri location. As we followed our typical protocol, as we always do, for diseases that are reportable to the health department, and reported it to the health department where the child was seen and tested.
Okay, because there has been a report of a child in Wyandotte County, and I don't suppose you can confirm whether the Wyandotte County child is the same child that you may have seen.
I cannot confirm that, but you can call the Kansas City Health Department and get more information.
Was that facility that the child was presented at shut down for any period of time for cleaning?
Or is that
That's
that's a
me.
you question?
Yeah, but I can't talk.
The 9 people, the 9 staff members being tested today, what's the reason behind that?
So staff members are being evaluated who have new onset symptoms. They are going through our mobile COVID-19 testing for Children's Mercy employees only, and we are and they are being screened through the following criteria: fever, or new cough or new shortness of breath, and having traveled outside of the Kansas City metro area in the last 14 days, or have been exposed to a known person with COVID-19 within 14 days of their symptom onset. The testing is being done by occupational health via our telehealth mobile truck, and doing this will continue to protect the safety and well-being of all of our faculty and staff, and by identifying cases and limiting the spread of infection.
Can you speak to just how dangerous this virus is for your population of at-risk kids?
Well, this virus is certainly dangerous or thought to be more dangerous for people who have compromised immune systems or chronic medical conditions. We also know that that the elderly population tend to have more severe symptoms as well.
But in this particular case, you felt it was appropriate to send the child home and they could recover with their family.
Again, this child had mild symptoms.
What I can tell you is this child came through our emergency department with our typical presentation system. We have increased the system, with coronavirus spreading. We currently are separating our patients with fever, cough, respiratory illness symptoms. We are separating them in the waiting room, so they are automatically taken to a different area from those that do not have respiratory illness symptoms.
I think Dr. Myers, though, mentioned that there was some information about this child had possible exposure to the coronavirus. Can you elaborate on that? How did you learn that?
In part of our screening process, we ask about respiratory symptoms, fever, cough, and shortness of breath, the 3 that have been linked with coronavirus. We also have asked about travel history and positive contacts with coronavirus. And if those conditions are met, then we increase the suspicion for coronavirus, and we are testing for those as well.
What do you mean by positive contacts with coronavirus?
If they have a positive direct contact, usually a family member that they are in close contact with, a household member, is a direct contact.
And was that the case here?
There was a contact somewhere in this situation, but I can't release that information right now.
And was that the determining factor in saying we need to test?
That was the primary decision is this kid presented with fever and cough. Those are the biggest issues. Kids that do not have any symptoms at all and are healthy children just with contact are not being tested. So the main reason this kid was tested was because this child had symptoms of respiratory illness and a suspicious contact.
Respiratory illness alone, though, could have been just flu.
Correct.
Would that have prompted a test?
This kid also had this possible contact with somebody with coronavirus.
So that seems to me like it was a determining factor.
Yes, so there's 2 layers there. But people that only have contact with somebody positive for coronavirus, if they have no symptoms and they are completely healthy, they do not get routinely screened.
I am encouraged that you're able to test because someone who might otherwise be considered low risk, because I know people have been worried about the availability of tests. Can you say something about testing not being an issue for anyone you want to get tested?
Currently, right now, we have testing available at our institution for those patients that meet our criteria for testing. So it's not available for everybody who wants it, but they have to meet certain criteria to warrant testing. Testing supplies are very limited across the country, as people know, and we also have to balance testing our patients, protecting our high-risk population, and maintaining adequate supply over the long haul.
But I guess the hopeful note that is even a so-called low-risk individual, a young person, can get tested if you suspect it.
If there is a positive contact, so low risk, if patients have fever and cough and they have mild symptoms, they are encouraged to stay home and not be tested. At this time, if you have contact in addition to those symptoms, then yes, that testing is available as of today for testing.
Have you had an influx of the worried well coming in and thinking, I didn't want to be tested, I'm just not sure?
We have had some influx of worried well. We are encouraging people, if they have concerns, to speak with their primary care physician first, and they can help navigate the system. We also have a nurse advice line that is helping with call-ins about people that are worried, that just have questions. But we encourage them to go through their primary care physician first.
If somebody has a kid that's presenting symptoms, I assume you want them to call you first before they come in?
They are instructed to call their primary care physician to help determine if testing is warranted. If testing is warranted, there is a process in place that we are notified prior to their arrival.